Now let's go ahead and remove this splint from the study model. And another desirable aspect of a splint like this, we'd like it to last a while, so it needs to be a minimum thickness in the posterior. So on a full hard splint, we would want to see that it's at least 1.5 millimeters thick. And I'm going to go ahead and measure this. It's a hard soft one. I already said that it's usually about 3 millimeters of hard material and 0.5 millimeter of soft material, and that's what this one is. This one's just about 3.8 millimeters as I measure this with the caliper. And so we're going to have a splint where the patient can wear it and grind on it and brux on it, whatever they're going to do on it, and it's going to last for a while. It doesn't need to last forever. Obviously, the thicker we make it, the less comfortable it becomes to wear because the patient's jaws are farther apart when they try to go to sleep. So we want to make it so it's going to last for a couple of years. Around there is basically the life expectancy of one of these. At the same time, it's got some patient-friendly features, the ability to have a soft layer on the inside, so if they don't wear it for a week or two, it'll go to place without causing any kind of headaches. And of course, if it really starts to fit poorly, they can put it into some hot water, or you can do it in the office, reseat it into their mouth and let it cool, and the memory of that soft material will adapt to the new tooth position. Before we take the impressions for the occlusal splint, let's spend a little bit of time talking about impression trays and impression material. Typically, the way to take an alginate impression has been in a stock metal perforated tray. And these metal perforated trays are fantastic. The only problem is that you have to have a rather large inventory on hand, and they're not cheap either. So sometimes we would try a tray into a patient's mouth, and we might have to try in 2 or 3 sizes till we found one that fits. And now all these other trays need to be disinfected or sterilized. And so you have to have a lot of trays on hand to be able to do this. And there's a new tray that eliminates a lot of this variability. And it's called the Adjust-A-Tray. It's from GC America. I want to show you this because I don't know if you're familiar with this tray or not. It really keeps us from having to stock tons of sizes on these trays. And when you look at this tray, you can see that it's got an open hinge at the front, and then there's 4 different sizes that we can choose on this tray, all the way from small, if we go completely closed like this, and there's 4 sizes. There's a medium, a large, and an extra large, and as you move it through these positions, the tray snaps into place. It's also perforated, which is fantastic, meaning it doesn't need any adhesive painted on there. It's also got some additional ridges to help hold it in place. It's a nice, well-made tray, and you can try it into a patient's mouth at a size medium, for example. If it's not big enough, you just take the tray out, snap it over to a large, and try it back in and see how that fits. It's also got some ridges that you can see on the side in addition to the perforations, and these allow you to actually break little pieces of the tray off if you want to use this for an edentulous study model. In fact, you can break all of these off, or if you just have an edentulous quadrant, you can just break off a piece of it over here on the side as well. So I'm a huge fan of these trays, and I now use this for all of our study models, all of our posing models, for bleaching splints, for occlusal splints. About the only thing I don't use these trays for is for our crown and bridge work, where we still use custom trays fabricated by the laboratory. And the good news is, of course, it comes in a lower tray for the mandible as well. When it comes to taking impressions for study models or for occlusal splints, the standard material of choice for decades has been alginate. And alginate's got some very desirable properties. It's certainly very cheap. It's very hydrophilic. It's about the most hydrophilic material around. But beyond that, it's got some problems. For ultimate accuracy with alginate, it really needs to be poured in your office, especially if you think about the fact that we're here in California and you doctors watching this are out across the country. By the time you take an alginate impression and wrap it in a couple wet paper towels and seal it in a Ziploc bag and send it out to us, you'd be surprised how many times we open that bag and the paper towel is completely dry. All the moisture is evaporated from it, the towel's kind of stuck to the alginate, and we simply have no way of knowing, how much distortion there's been in that alginate impression. So what I like to use instead of alginate is one of the alginate replacement materials, and my favorite happens to be Alginate, and this is from Kerr. And it's not alginate, it's an alginate replacement material. In fact, what it is, it's a polyvinyl siloxane material, like a regular crown and bridge material, except it's cheaper and it doesn't have the detail, it doesn't have quite the viscosity, it doesn't have the different viscosities that are available in a crown and bridge material. But unlike alginate, it's much more accurate when it comes to the occlusal surfaces of the tooth and picking up tooth structure. It doesn't need to be poured right away. It can be poured 5-7 days later. It can have multiple pours. There's a lot of great things about this material, and of course it is slightly more expensive than alginate, but it's really worth it for opposing models and for occlusal splints. As you can see, it's available in the gun form, or the form we like to use it in a lot of times is in the sausage form for the penta mixers, the automatic mixers, where you just press the button and you get that nice soft serve flowing out and into the tray. So this has become my impression material of choice for just about everything having to do with bleaching splints, occlusal splints, opposing models, anything besides the actual crown and bridge impressions is going to be done with the Alginate FS, the fast set material. You can see my assistant has filled the tray. This is the Alginate material from Kerr. It's probably the best name in dentistry for any product, especially an alginate replacement product. And she's put a little extra on her index finger, and as you can see, she's going to smear this on the occlusal surfaces of the posterior teeth and then along the incisal edges of the anterior teeth. Really, this is the areas that we have to capture on a occlusal splint impression like this. Then she's taking the adjusted tray that's been filled with the alginate material. This is the fast set material, and she's seating the tray into place. So when you think about an occlusal splint and where it's going to fit, the areas that we really need to have in good focus, good definition on the impression on the model are going to be the occlusal surfaces of the posterior teeth, the occlusal third of those posterior teeth, and then the incisal third of the anterior teeth. So if you take an impression like this and you get a bubble, along the gingiva on one of the molars or one of the bicuspids, or you have a pull on an anterior tooth, by the gingiva or up by the frenum, it's not a big deal because these are all areas that are not going to affect the fit of the occlusal splint. And my assistant has now filled the tray for the lower opposing impression. We're still using the alginate for the lower impression. In fact, we use these alginate replacements like alginate for all of our impressions, and that's kind of one of my pet peeves that I see here in the laboratory. We'll see a dentist send in maybe a case that's, let's say, 8 crowns. So this is something where the patient's going to pay maybe $8,000 for it. And we'll see just a really cruddy opposing model that was taken in alginate and then sent to us from New York. So 3 days later it's getting poured up, and it just kind of bothers me when I see people take a cruddy opposing model for something like an $8,000 restorative case. And even for a splint like this, it's not that big of a deal to use something like alginate and spend a little bit more and get a great impression that's going to be stable over time and can be poured multiple times and be extremely accurate. So try not to skimp on these opposing models, even though they're just opposing models. So let's go ahead and take a closer look at these impressions. Here's the lower one, the opposing one that we got. Again, by spending a little bit more and using a little nicer tray and getting a good impression of the opposing model, we're just going to make sure that when the laboratory goes to hand articulate these models, that we're going to end up with a nice result. We're going to end up with a nice accurate model on the lower, and you can see how good that looks. Let's take a look at the upper one for the splint. Now, because this is a splint and it's not going to come anywhere near the palate, my dental assistant always knows not to place any material in the palate. Remember, the occlusal splint is going to follow the outline of the teeth, and it's going to come up about 1/3 of the way on the facial surfaces of the teeth, and it's going to cover the entire lingual. So we're looking around the lingual to make sure that we've got all the detail along the lingual. And then we just need the incisal third of those anterior teeth is where the splint is going to fit. So as we look around, we just want to make sure that we get the junction of the tooth and the gingiva on the lingual as we come all the way along here. And when you pour this up and get a look at the stone model, the detail on these teeth is really pretty amazing, and that's why I've chosen to stick with the alginate replacement materials like this one, the alginate. My dental assistant has finished taking the impressions for the occlusal splint, and in fact that's one of the things that I love about providing occlusal splints for my patients, is that a well-trained dental assistant can practically do the entire procedure by herself. Because an occlusal splint is a provisional appliance, the dental assistant can take the impressions, can seat the splint, can make adjustments to the splint, and deliver the splint without me ever having to walk into the room. You may also notice that we did not take a bite registration during the impression procedure, and we never have to take bite registrations for these types of hard soft splints. As you'll see later in this presentation, the Occluform, the built-in articulator on the thermal-forming machine that fabricates these hard soft splints, makes it so that we don't have to take a bite registration.